Fundraising. My name is John Mills, and I'm in North Carolina, and we're pleased to have Jenny Koltnow and Ann Langston from Church Health in Memphis directing our training today. So take it away, ladies.
Okay, thanks, John. Go ahead and introduce yourself, Jenny.
Well, good morning, and thank you all for joining us. My name is Jenny Koltnow. I'm the Director of Communications and Development here at Church Health. Next week will mark my 2-year anniversary. So super proud and fortunate to be part of this organization, but eager to talk with all of you. And I think the timing of our conversation today is excellent because this is such a crucial time of the year for giving and for people to be in the mindset of, I need to give back. I want to help someone. I want to help my community. So I'm just hoping that this will be helpful for everyone.
Great. And I'm Ann Langston, and I'm the Director of Development for ECHO and a Senior Director of Partnerships here at Church Health. Tomorrow I will celebrate my 20th anniversary as a staff member of Church Health, although I've been part of the team since before it got started as a volunteer for about 13 or 14 years before I came on staff. I am really thrilled that the timing, as Jenny said, is where it is today, because I wish you could see the room behind us. This is the time of year when we bring together probably more volunteers that are excited about doing something for Church Health than any other time during the year, because we have a major Christmas card program. So I hope today we'll plant some seeds of things that you won't be able to do in your first year or your early stages of operation, but some things that 32 years from now hopefully will have a future and a history that will keep building. We started this program probably 28 years ago is about my guess, and we now send out about 25 Christmas cards every year. 25,000, excuse me. So there's a way to get started. It started with a handful of people writing Christmas cards, and now it's a 2-month-long process. So let's look for some things that work for you for the next 32 years. Okay?
So what we'll do today, we have a handful of slides that are just very high level to give us a basic place to begin a conversation and make some recommendations. But we do want to allow time at the end for you to ask any questions you have, for us to recommend other resources that might be useful. So,
yeah. And I think it would be helpful as we start through today for you all to interject that you have access to this group or one person, because hearing that from each other is the best way to generate new ideas, particularly for young startup clinics. And I mean, I know that Dr. Dillman has access to lots of church groups, and how to activate that is very important. Phil, I don't know what you have access to, so we'll be interested to learn, but let's share with one another as we kind of go through this process. Okay?
So first of all, what we wanted to do was really begin with a, sort of basic inventory and review of your relationships. I think that at this time of the year, you have to think almost in concentric circles, both to see who can assist you in your fundraising efforts, as well as who would be willing and able to contribute. So there's several different areas and several things that need to be considered in order for this to be, worthwhile and for this to kind of be a strong foundation for your year in fundraising. Okay, so first of all, the issue is, do you have contact information for your contacts? Do you have their addresses, their email, their phone? Do you know that it's current? Do you know their spouse's name or place of employment? By having current contact information, number one, you're not going to have the sort of, inadvertent slip up of, oh, wait a minute, she prefers to be called Ms. instead of Mrs., but really making sure, too, that your information that's going out is going to be clear, and then second, that you're going to have multiple vehicles to communicate. Where, for example, any calls or letters can be reinforced through e-news or emails or any other correspondence going out.
So let me add to that, because sometimes in early stages, there's not a great database. I don't know if you all have something, whether it's an... Okay, Catherine, welcome to the call. We're just beginning to talk about how you assemble good contact information, phone numbers, addresses, complete names, correct spellings, that type of thing. And many of you may have that set up in some form, as I said, an Excel spreadsheet or something simple. But let's say you don't. Where do you start? Well, I would say the best place to start is your smartphone, because I'm guessing that all of you have contacts in your smartphone. And if you can gather the people that are close on your team, whether they're members of your board, a couple of other staff members, and simply load that information into some kind of format that you can have as a contact list to begin. I know everybody's at a little bit of a different stage, but it's important going into this holiday season and year-end giving that you begin that if you haven't already done so, or that you double check it and enhance it if you have something. It's also a good time to look around you and say, who else could contribute to this list? Let's say you've just made a new affiliation with another church group in town. Maybe it's just a Sunday school class. Be great to get the name, address, and phone number and email of the leader of that class, and ask them to pass it on to their class members if they won't share that whole list with you. But when Jenny talks about concentric circles, begin to think, who else has a circle that has a good either email, phone, or mailing list?
That's right. The second thing is, kind of piggybacking on what Ann said, is really looking at who do you have to help you, and really leveraging those and being confident in your work, being confident in your mission in order to ask them, are they willing to help you? The ways in which they can help are varied. It may be they're going to call 5 people on your list. It might be that they're going to speak to their Sunday school on your behalf. It may be that they're willing to sign a letter with you to just substantiate the support that you have. But there's a lot of ways, some that, are simple but still powerful, and some where they might be even willing to rally others to do something as simple as stamp and stuff envelopes. So looking at who can help you, because the last thing you want to do is feel like you are doing this entirely on your own. But each of those engagement points, even honest to goodness, like even something as simple as sticking labels on an envelope, is a way where people are giving back. And you never know. This is why, to Ann's point earlier, we have hundreds and hundreds of volunteers who connect with us each year just by signing cards and stuffing envelopes on our behalf. You better believe they feel part of the church health team. But even though, their giving over the years has been modest, their gifts to us have been pretty substantial.
So the other thing I think you need to think about, though, at this stage as you're looking at that is what's doable, and don't try to take on everything. We're going to talk about several different types of approaches that you can take in terms of contacting folks. We are not suggesting that you try to do all of these. It's better to do 1 or 2 and do them well, even 1, than not to have a good message on the front end, a good set of contacts to distribute it to, and then more importantly, a good opportunity to follow up. You don't want to send something out and then have nothing happen. If it would help just to be either sending a follow-up email, having some follow-up phone calls. Mm-hmm. So we'll go through several things around the types of contacts that you can make. And then what we're going to suggest is that you come up with a very workable plan.
Yeah. The next slide really leads with make a plan and don't wing it. So to Ann's point, there is a limited amount of time here. And for all practical purposes, we're sitting here on October 24th, And, 2 months from tomorrow, we'll be at home, hopefully drinking hot cocoa and surrounded by loved ones. So really looking at, taking the next 9 weeks and saying, okay, this is what we're going to do, and really plan sequentially. What are your goals? Who are your partners? Who's your extended team? And then what tasks can we take on? And to that end, really sharing that information with others to keep them informed, to help them know the role they can play, and to know how it will lend to the broader objectives. So, as we said, you've identified who's on your team at this point. And then the next step is, especially since it's year end, looking at how you can sort of create a sense of urgency. Why now? Why does it matter that someone support you now versus, when, I don't know, some other time? So, certainly you can capitalize on this being a time of the year where people are more inclined. And frankly, you're getting messages from pretty much everybody that this is the time to buy, this is the time to give, this is the time to take action. So to leverage that, I think, is how do you get folks to focus on you? And I think there's 3 particular things that I think are valuable. Number 1 is, what are you going to do with the donations? How does that matter? And to that end, why that person, like empowering them to do that with you, where they're a valued partner, a team member, an ally in your mission. The second thing is being clear about your needs. And your needs are different. Each of you have different needs. And so it's not like I can say, focus on this or that. You know what you need. You know that you need to raise $10,000 to purchase this, or to hire them, or to expand hours here or there, whatever those things are. And so to be clear and tangible about that, I think, is very useful. And then another thing you may want to consider is even putting it out there to let people know what a specific gift can do. What I think sometimes nonprofits get in, where they get, and I think this is just sort of a public perception, is that a gift isn't worthwhile unless it has like multiple zeros at the end of it. If by building, especially now, building a base, even if those gifts are at $25, $50, $100, $500 increments, all of those are a place from which to build. And so what does $25 a month do? What does $1,000 do? What are some of those things? And sometimes just by someone saying, wait a minute, if I donate as much as, $75, it's going to make sure that a family of 4 will be able to get their flu shots and a checkup. Those things, that's when people feel like my gift, however modest, made a difference. Another thing that may be within reach is looking at finding a challenge gift. A lot of people, and I've been surprised by this. I don't know about, in my former life, I worked for a couple different foundations. And oftentimes we would say, okay, we will match all of your gifts up to $10,000 or up to $100,000. I have learned really, not that just sounds good, and it's not true. Like a badge of honor, credibility for that nonprofit, but honestly, that is an incredible motivator, not only to say, wait a minute, my gift will be doubled, but also I've got to do it by this date in order for that to help that clinic, that charity, that organization. So even if, again, the challenge gift doesn't have to have, lots of zeros at the end of it, it is a matter of creating that urgency and then being able to rally your team, your volunteers around a really exciting opportunity that will help bring you to the finish line this fall.
We'll talk about stories now?
Yes.
Okay. One of the things that Church Health has done since the day we opened is make sure that people understand, and you all know this better than even those of us who have been doing this for a long time because you're involved directly in your clinics, but being able to tell a story of somebody that you've helped makes all the difference in the world. People want to relate to an individual. Yes, they want to make sure you get that new piece of equipment or you're able to hire that nurse or that medical assistant. But what they really want to know is who is the person and what is that help that's being given. Opening a letter, opening an email, opening any kind of communication, whether it's a phone call or not, with "let me tell you about," really makes a big difference. We have around Church Health this many years later still talk to our staff every week, every day, particularly those that are on the front lines about communicating stories to us. I'll give you an example. Last week, we have a family medicine residency, and I was meeting with the residents talking about some population health issues. And I asked them to talk to me or tell me a story of an encounter that they had had that was meaningful to us. Well, one of the young residents told a story that I will tell now for years about being on hospital rotation and seeing this guy who was very erratic behavior in the emergency room at the hospital, and coming to Church Health where he was referred after that emergency room visit about 3 weeks later. And the resident walked in the room, and the man almost cried because he was so excited to see somebody that was a familiar face. He had been bounced around so much, never being able to get any continuity in his care. The resident now thinks of this patient as his new buddy and his friend. And we think the guy will probably follow the resident wherever he goes into practice if he can afford it. But that's the kind of communication that you want to spread to the people you're communicating with. That this isn't about a number, patient number 100. This is about John Mills who came to us and hadn't had care and what we were able to provide to him. So you all have those stories. Thinking about how to communicate and tell them in one paragraph in a letter, because you don't want anything to be more than a page, is very, very important. Spending that time on the front end and sharing that with your volunteers, or asking your staff, board, and volunteers to share their own stories is really critical.
Mm-hmm.
Okay.
And to that end, just a couple other little housekeeping items related to getting those testimonials. First of all, some patients may be a little reluctant to share their story, but you know it's something powerful. The story does not obviously need to be collected by you, but maybe it's the provider, maybe it's a nurse or a volunteer, somebody that got to know them. The second thing is that the story may not be told by the patient his or herself. It might be their child, it might be their spouse or a best friend, or even the provider, his or herself. The third thing is, in the event, especially, and you got to feel this out yourself, but, words don't take you so far. But if you can get, first of all, a quote, and second of all, a picture, sometimes that can be very useful, and just all of a sudden people kind of stand up and pay attention in a different way. And then the last thing is, we all have to walk carefully around issues around HIPAA and so forth. And so having a photo release or a testimonial, like a release, and certainly we can share a template for this, but it's something just to make sure that in the event you talk about patient Bill, whose A1C levels improved dramatically with the help of Dr. Roberts, like that, you want to make sure that you can use Phil's name and or image and or testimony in the sort of public forum. And that is a CYA risk management must, but also make sure too that their identity is protected and that they know how their story might be shared. Shall we go on?
Yeah.
Okay. So the next step is looking at the actual tactics. And we first wanted to talk about phone calls. So the phone is a lovely tool in fundraising. I think you'll find that it is such a novelty for folks to receive a phone call and to actually talk to a live voice, that it's going to create more momentum and a deeper connection than any perfectly crafted email could achieve. What I would first suggest is, starting with, those people who have already invested in your work, either as volunteers or as spokespeople or board or donors. Personally calling them, really like scheduling it into your day. Like, this is a regimen that you have to sort of maintain, saying, okay, X number of days a week or whatever, where you are going to block your calendar just to make donor calls. And even if you're stuck leaving voicemails, again, it's that personal touch. And then also look at, over the months, years, you have talked to people about your work, your mission. Going back to your phone, your contact list, or, past emails, who are those people who have taken an interest in your work, where the call doubles as an opportunity to update them on what's taking place, as well as going back to some of those points around, this is what we're trying to accomplish this year. This is what we need. This is why your support is so important.
So I would say on phone calls, this is one of those when you're making your plan that you need to be very thoughtful about, because phone calls do take more time than some of the other strategies. So you need to make a list of people that, it doesn't have to be somebody you think is going to make a gift, but somebody that you really want to understand and know what you're doing and want to bring them closer to the organization. That's a great place to start, because asking them for a gift on the phone will be a very logical thing that they will expect to happen. Write it down is often a real important thing, because you don't want to hang up the phone call having not at least planted the seed that you want to ask. We are all in the sales business, whether we're taking care of patients or raising money. And part of that means you have to say, will you help me? And you need to even make a suggested amount. Don't undershoot it. People have heard this forever in fundraising. People are more flattered to be asked at a higher number than a lower number. And you can always say, I would like for you to consider a gift of $1,000, but anything is helpful to us. That gives them a lot of latitude to say, I can't do that right now, but I'm going to send you $250. But make an ask of an amount, or at least put a range out there and say, if you were able to help us by giving us $250, that would let us take care of 3 more patients, or whatever that number makes sense for you. But tying it, as Jenny said, to something that's tangible for them and making it a connection that they are directly helping somebody will make a difference. But the most important thing I'm saying is you have to make the ask. You have to make the ask. You can tell them what you're doing. They can say, I'm really not interested in it right now. That's okay. Still make the ask. Still say, Dr. Jones, I know that you've got lots of other things that you've explained to me, but I hope as you come toward the end of the year, you will consider a gift to us, and we would hope it would be somewhere in the range of, and then let it go at that. But if you don't ask, you won't get.
Right,
so.
Exactly.
Okay.
2 other things. First of all, your call team can be as far and wide as you would like, but making sure, and for one thing, it may be that you're going to get a little bit more success if your partner Ann makes the phone call instead of you. So look at kind of making those connections. And we do this all the time at Church Health. I can't tell you how many lists we go through and say, Stuart's going to call this person, Ann's going to call these 3, Jenny's going to call these 4, so-and-so. We do that divide and conquer all the time. And we also lean on volunteers and board members to do the same. It's just like, how do we get a little bit closer, have that more personal connection? The second thing is, even like the follow-up that you do after that call is really important. It may be, hey, I'm going to send you a story about a patient. It might be a handwritten thank you note, or it might be just a call a month later to say, hey, those 3 patients that we told you could help, this is what happened. So consider it just a step in a particular direction, but having some kind of follow-up to that, or say, hey, love talking to you last Tuesday, really appreciate you considering support this fall for our clinic. Those types of things, again, it's just getting it back on their radar when there's so much other noise that, might be filling their day.
So in addition to this, and this applies in other categories as well, when you're talking to people, I think one of the most successful things we've done is help people find ways to honor those that they love and appreciate with gifts to Church Health. So in talking to somebody on the phone and you happen to know that they lost a loved one or a friend last year, or they know that someone in their congregation did something really nice for a group of other people, suggest that. Say, Kimberly, I know that John Doe in your congregation took on, taking a group of children out on a mission trip. Wouldn't it be wonderful? You've been so appreciative of him. Wouldn't it be wonderful to give a gift in celebration of his gift to others as part of your giving at Christmas time? Those types of connections, I will tell you, you can build on them year after year after year. A program we started many years ago. So can somebody look and see if they're unmuted? We're getting a lot of feedback. Does anybody not have their phone muted?
I don't think I have my phone muted.
Okay.
Can you hear me?
I can hear you,
yeah.
Yes. Thank you. It's interesting because it actually sounds like there is a bird or something in the background. Yeah. I don't think you're chirping. But one of the things we started many years ago was giving gifts in honor or memory of people. And we have a program we call our Days of Giving. You've probably heard about this in the past. The holidays are a wonderful way to introduce a program like that and say, as we're moving into the holidays and starting the year of 2020, we would be so grateful if we knew we could provide a day of care in honor of your spouse. And ask for a gift, set an amount that you think is reasonable. Ours has been $2,500 for, as long as I can remember. We look at raising it and we've decided it's a good place to stay. It's a great entry level for a major donor. But asking somebody to do that and then telling them, on that day, you pick a day, your birthday, your anniversary, we'll be happy to call and have your spouse come down and spend some time with us at the clinic. We'll call them and wish them a happy birthday. You can flesh that program out. But this is a great time of year to do that. People don't want another thing, but they love to be remembered. And this is a great time of year to talk about how you can honor or remember somebody. And it doesn't need to be a big gift. It can be, I want to honor our pastor because he does amazing things. And we want to give his spouse something for the fact that she shows up at everything. Okay. Just think about a little bit outside the box on those.
And no, too, it is not unusual for us to get a call from someone who says, okay, I'm donating, say, $100, and I'm doing it in honor of these 10 people. And we just, again, it's not about the sort of value for those, like, smaller memorial or tribute gifts, but it isn't, in fact, a way. Now, not only do you have that person engaged, but now you've got those 5 or 10 other people. They've given you all of those names, and so suddenly now they're getting correspondence from your clinic, and now maybe there's a way to engage them because their friend chose to make a tribute gift in their honor.
And that tribute gift that is made in their honor will also be a very big endorsement of your organization, because if I give something in honor of Jenny, Jenny knows how strongly I feel about the organization that I'm giving to, and that validates that and may bring her into the circle as well.
Exactly.
But holiday tribute gifts is the perfect thing to focus around the last 2 months of the year.
Yeah.
Okay.
Okay. The next piece we wanted to focus on is really the very personal outreach you make to your major donors. So how you define major donors really on you. For us, it's, we kind of define it as, saying like kind of at that 500 and above. It may be, but where are those people who have already made a gift or have the potential to make a bigger gift? And taking the time to reach out to them and ask if you can take them to lunch or to coffee, or just even meet them in their office or in their home. The personal contact, the opportunity to engage them and to ask them what they care about really does matter. So, this is one thing, it's kind of a step up from the phone calls. So you can't do, 100 of these in 2 months, but it can be singling out who can you take to lunch or who can some of your board members take to lunch in order to have a deeper conversation and then to make that ask.
So when you're making your plan and not making it overwhelming for you, again, measuring this out, say, I can only do 2 of these in the next 2 months. 2 is better than 1 because those are 2 people that you will have finally gotten in front of, and you can say, I just want to see you and wish you blessed holidays. So we meet for coffee and visit and let me bring you up to speed. It's a good time. Sometimes it's crazy for a lot of people. Actually, the holidays become times when people want to spend a little more social time and step aside. So you often are able to make those appointments then. So then we want to move on to something that can be done without necessarily your involvement, but with a group of volunteers or your board or your staff jumping in. Even a Sunday school class or a book club can help you get a mailing out. So,
So what we do each year, and it did very thoughtfully, is having a fall appeal letter, a Christmas appeal letter, where you are really articulating the need, recognizing the importance of your donors, your partners, and empowering them to make a difference. Generally, these letters are a single page. Generally, we have a clear call to action, and they also emphasize appreciation, gratitude, and support. It's also a great place to even drop a brief testimonial from a patient or a patient's story to give them a little bit more context of how you have made a difference for Anne. You have brought Anne's, enabled her to walk more comfortably or to get through during time of need, whatever the case might be, relevant to that patient's story. But in addition, I want you to be thoughtful about a couple things. Number one, I don't think there's anything more annoying in just standard letters than the thing where it says, Dear Jenny Koltnow, or Dear Anne and Dudley Langston Jr. Think about making sure that your salutation in the letter is their first name or Mr. Joe and whatever, but just take the time to do that. And that's sometimes this is a matter of having a column in your spreadsheet for, on the letter envelope itself, it'll say, Dr. and Mrs. John Doe. But in the letter, it'll say, Dear Nancy and John. The second thing is, think about who's going to sign the letter. And is it one person? Is it multiple people? Is it somebody who your audience knows? We just sent out a set of letters last week, and the letters were specifically to major donors, but we had 4 signatures. And the goal of that, and we've done this a couple times before, it's really effective. It was not Dr. Morris, our CEO. It was a board member, female. It was a volunteer doctor, male. It was a young man who did a gap in the program in our clinic. and another community member. So I say that because hopefully every one of the people who received our letter knows at least one of those 4 people who signed the letter. And then the other 2 things, first of all, having handwritten signatures matters, not like a stamp, and even writing a note. So even though you have this letter, even to be able to say, hey, Kimberly, great to see you at the grocery store last week, really appreciate your support, or Steph, your work matters to us, love you a lot, whatever that is, depending on how well you know that person. But taking the time, even if it's just a sentence, to write in the margins goes a long way. And then the last thing is, like, when you're looking at assembling things, it's really easy to send from mail house, window envelopes, whatever. But I will say you can label the envelopes and then use a stamp instead of running it through the meter. Don't ask me why. I just think it matters. So those little personal touches where it seems like it's a letter from a friend instead of something that was like, mail house will go a long way. And then put a remittance envelope in there, like something that they can send back to you. I realize it's 2019. I realize that mobile technology has enabled us to, at any moment, give online. But the truth of the matter is that like 92% of all charitable gifts made by individuals in the country still are made by check.
I have an interesting story about that. One of the best fundraisers I've ever met sat down years ago with me and said, I kept saying, we're sending all these letters. We need to get past this. And we would love it if people would just give us their checking account and let us make a monthly, deduction from their checking account or run it on their credit card. We still want that. Don't get me wrong. But she pointed out something to me that has never left me. Sitting down and writing out on a check to Church Health and signing your name is an act that connects that person to you. And they feel then that they have actually almost signed a contract or an agreement to support you. So it's not a bad idea to keep taking those checks and keep asking for them. But the one thing Jenny said is critical. If you spend money on anything, running letterhead is an inexpensive thing. You can do that at any off-your-own computer. But spend the money to get a remittance envelope that is addressed back to you, that gives people the ability to fill out information with their name, their email address, their phone number, their church affiliation, if they put that on there, and also gives them the opportunity to make that gift as a tribute in honor or memory of somebody. That envelope, it amazes me. We will get them in the mail, and somebody will have kept an envelope from 10 years ago, somewhere in their desk drawer, and they'll fill it out and send it in. Mm-hmm. We don't send anything in the mail without a remittance envelope in it because people want. We used to have people call and ask us for boxes of them because they did their memorials to us. So don't forget to make sure that that's done right. Okay.
The next thing we wanted to highlight was looking at how you can build an email campaign with a call to action. Email itself is really a helpful tool to inform and to recognize donors, volunteers, leaders, etc. But looking at how the email campaign in and of itself is seldom successful on its own, but it is an excellent way to reinforce these other things: the letters, the calls, the meetings, etc. So what we may want to do in the spirit of planning and making the most of your next 2 months is how can you schedule 5 to 10 messages between now and really the 31st of December with a clear, consistent call to action. You want to make sure that it just presented well. You have a
short and sweet.
and that it's really like, we talk about like the top of the fold, but when you pull up an email, whether it's on your phone or on your laptop, you don't want that call to action or that link to give to be buried at the bottom. So having, adequate placement so that even if they just pull it up and read the first few lines, they see, oh, wait, this is where I do it. So, when it comes to online giving, efficiency, quickness, like being able to like click and go is essential. And sometimes taking the extra like 3 or 4 seconds to scroll to the bottom is a complete like DOA. So you want to make sure you get them quickly. So, because they know what you're asking. Yeah, they know that. I mean, it's all, everyone's raising money. So if they can just click and go and get to the site, we'll get to that in a moment, but just making sure. And then the other thing is making sure that your messaging is clear. That all of those messages, that's the planning to say, this week we're going to emphasize this week we emphasize that. But each time we say the action we want them to take is give online, help us reach this goal. We have a match, etc.
One PS on that, if you've got somebody that can do the technology for this and do it right, do it. If you don't, wait until you can do it right, because you don't want to just be sending out things that will just end up cluttering people's email boxes, and they'll be more irritated by that than if you can make a link and connect it correctly.
The next part we want to talk about was social media, and looking at how you can utilize Facebook, Instagram, and to some extent even Twitter or LinkedIn. And I think this is where, and what I'll oftentimes say when we train our ECHO clinics is that less is more. Because once you start, you just want to be consistent, be clear, and make sure that the presentation is really strong. People are not looking at social media generally between like 9 and 5. It's at, 7 o'clock at night. So when people are just stumbling over your website or they look at your letter and go on there, you want to make sure that you're just putting your best foot forward. Social media is a great place to share stories, to have those photos, and to also reinforce like why you're here and really the important role you play in your community. Couple things that are also especially useful. One of them is that third-party validation. So if you bring in, whether you're posting it or someone else is, and by tagging you, it gives somebody else an opportunity to really reinforce why your organization is important. And then the second thing is look at like how you can really reach out to those relationships, that network, in that peer, and leverage that peer-to-peer network, so that there are other voices, other influencers who are driving home your message. I think those things are really important. And likewise, that you are thoughtful about what links and what opportunities there are to recognize those who are supporting your work.
Again, I will say this, both in terms of your Facebook or your social media work, your email, your website. If it's not up and running, now's not the time to start. Put your energy into the other things. But if you've got that in place, take advantage of it. And social media is probably the least expensive and has the most connectivity of anything that you can do. If you've got a handful of board members that just happen to be active on Facebook, then that's a great way to just get them to make a simple post. And the cost is little. So,
one thing too, do you move next? Is this the next one? Okay. Or the website?
Yeah.
Okay. The other thing, and it kind of piggybacks on this, is that if you have a website, just make sure that your online giving page and your giving form are very easy to use, easy to navigate. The thing trips up people more than saying, where am I supposed to give, or I don't know how to find it, or there's no link from the homepage. So when really take the time to think, even ask your teacher, hey, go try to get a donation to my organization, or ask your next door neighbor. Ask people who have absolutely nothing to do with anything to find this, and to also make sure that it looks as good on a mobile device as it does on a laptop or computer.
And again, that may not be something, if it's not already in place, don't try to do it quick and overnight. Take advantage of some of these other things.
Yeah. But just, again, people are going to stumble into it at odd hours. And so that page is going to have to speak for you when you're actually getting those precious Z's in the middle of the giving season.
Right.
So all right, another place that you want to look at is really how you can share your stories, and really throwing open the opportunities where beyond your own red outreach, you can work with others. So I'm just going to go through these, and these are all listed in the PowerPoint. But real quickly, one of them is just being a guest speaker at Christmas gatherings. But tie in your message and talk about your clinic in the framework of the Christmas season and really what that represents, like being relevant. Take advantage of how, this is the time when we really dig in and feel a deeper connection with others, with our faith, with our responsibility to help those in need. And I think that's a great place to help your message resonate. Another place is Sunday school classes. Look at, single out 3 or 4 Sundays where you or one of those people in your team can speak on your behalf. They don't have to monopolize the whole hour. It might be 5 or 10 minutes. Again, but have those remittance envelopes available, have some information, don't be afraid of the call to action. One of those opportunities is business luncheons. If you have a Rotary or Kiwanis or Lions Club or, Young Professionals Network or clergy or minister organization, all of those sort of business luncheons, coffees, etc., are great places to share your message.
And if you have a business that you're connected to, oftentimes they are looking for something to bring their employees together around. I mean, we have law firms that invite us to come and talk to their employees at lunch and let them sign Christmas cards. This is a time of year when, it should be all year, but a time of year when people are looking for ways to connect with other people in their social network, as well as ways that social network can reach out and help other people. Look for where those pockets are and just say, hey, I got a plan. I'm happy to come talk about it tomorrow afternoon.
That's right. And then certainly if you have can reach out or work with your local media, perhaps there's an op-ed opportunity where you can send a guest column, or maybe one of your volunteers who likes to write or a volunteer provider, somebody who can talk about your work, talk about the difference being made. Social media, of course, as we mentioned, and then also others who are stakeholders in your work, can they post on your behalf? As I've met many of the clinics, sometimes, you're based in a particular church, or you're using a building that's owned by the local commercial development company, or your next door neighbor is a soup kitchen or what have you. Can some of those, giving them the tools and the information so that they can speak on your behalf. And then another thing that I did not have on this list, but we will add, is also like church bulletins and things and like church communications.
Yes.
But sometimes, I have been surprised. In fact, I've done this recently where I've reached out to a couple of kind of stronger newsletters where they represent like a whole denomination for our region of West Tennessee, asking, hey, would you share information about our fall giving or Christmas cards? And they're like, yeah, no problem. So this is the easy part, but it's really like getting out. And then one other related to that, if you're making presentations, try to gather the information of those people who are there, and or at least the person who's responsible for hosting you, because they're just part of growing your network. And, the follow-up, the follow-up outreach and so forth can be really helpful.
I know we're running close on time, so this goes without saying, but what Jenny just touched on is a really key part of the next 2 months. And that is if you just carry a yellow pad of paper around with you or in your phone, you write down the contact information of every single person that you are communicating with. You want their email address, their phone number, an address, some way to be able to follow up with them. You've got a golden opportunity over the next 2 months at this stage in your development to use this as a way to build a base of people that you want to continue to communicate with. And then the last slide that you'll get from us is January is thank you month. January must be devoted to saying thank you whether you got a gift or not. If you had lunch with somebody, coffee with them, if they let you come talk to their Sunday school class, a way in which you can say, thank you for this opportunity, thank you for listening, thank you for your gift. You can't do that enough. And then the thing that does is it gives you the opportunity to go back to that person in 3 months or at the same time next year because you've used your manners well, and your mama will be proud of you. But we really encourage that as being the way you wrap up every holiday season is it truly goes through the month of January. If you stop on December 31, you don't have anywhere to go next year. Okay, we have talked way too much to not give you time for questions, but we're going to take them anyway. Okay?
That's right. Phone line's now open.
That's right. Unmute yourself and ask questions.
John and everyone, this is Christy Daffron from Easter Seals Community Health Clinic. How are you guys?
Hey, how are you? How's Pell City?
Hey, Pell City is great. It's great. We'd love to have you guys come down sometime when you're driving through, Ann.
I may come back. I'm actually driving through on Saturday, but I don't think I'll be stopping that day.
I have a quick question. I came into the call a little late, and I apologize for that. Is the call going to be recorded for further listening to the information?
Yes.
Yes.
Okay, thank you.
And there'll be a PowerPoint that comes with it.
Okay, wonderful. Thank you.
So one question I have back for you all is this too much information? We tried to simplify because we know the phase that most everyone's in. And if you want to ask a question about what's one thing or this feels good to me. We would love that feedback, whether you send that to John after the call or some other way, because it'll help us begin to build an educational booklet for what's beneficial for startup clinics, because we have to go back in our memory a little while on that one.
Hi, this is Catherine with Purpose Point. I think everything that you guys shared, I came on just a few seconds or a few minutes late. Everything that you guys shared is right on point, and there was a point that you made and that you stated that basically to not try to, bite off everything. And to really just focus on what we need, one or two things. So, but what I like about everything that you shared is, at least for where we are at Purpose Point, it allows me to take some of the things of what we're at to do them now, but also to look in the future, like, 3 months from now, 6 months from now, and a year from now, to kind of plan and know in terms of, fundraising and outreach, what I can begin to start kind of, working on. So I kind of like that because it shows me what I can do now and then things that I can work towards.
Right. Pick and choose for the next 2 months and then use this as kind of a guide for what you can possibly do over the next 12 months. That's a good comment.
Yeah.
Good feedback.
Yeah, that's helpful. And I think too, today's call was specifically about year-end fundraising. That absolutely everything we talked about, short of speaking at a Christmas gathering, can be done 365 days of the year. So, and I will tell you, one of the things that we started doing a couple years ago at Church Health is having a big campaign in July because nobody else is. And our message really has stood out because we're not competing with the same intensity as we are at different times of the year. So yeah, any one of these things. And there are things that we look at, even some of the things that we just talked about today, we're like, that's a 2021 thing. So there are things too that we're saying, we don't have capacity, we don't know how we can pull it off well, but we will down the road.
I want to say one thing I omitted before. I totally agree with Jenny on that. But as you're looking at the next 2 months, don't wait until after Thanksgiving.
Yeah.
Families gather at Thanksgiving, and it is a golden opportunity for people to say, what are we going to do for Mom this year? Mom doesn't need another thing, but she is really excited about some things that are going on in the community. And she's mentioned this to us. Getting that out in the, whether it's through the newspaper, talking to church groups. I did a talk a number of years ago for a startup clinic, and they did it in early November. And I just asked everybody there to go to their Thanksgiving dinner and ask their family to pitch in and give gifts of a day for the local clinic. I was shocked that the CEO later told me that it actually worked, because you never know. But, you know, what could be better than the family putting together a gift for a family or their parents or something along those lines. But Thanksgiving, don't wait till December.
This is Stephanie Diehlman I'm from the Well Health Center in Cactus, Texas. And we find, we're actually struggling and just really, even though we're connected with the church and getting people to just really jump on and support us, especially with regular gifts. But a lot of times when people give, they want to give to something specific, like, you know, we want to give to something for children, or they like those specific things. But honestly, like, our biggest need is paying our staff. It's, you know, paying for malpractice and the EMR, and those things are not very exciting, but that's what our needs are, our general operations. And so how do you make that something that's exciting for people to give to? And I'm sure it's probably things like patient stories and whatnot. But anyways, those are usually our biggest.
Yeah,
they're not very
Kimberly, I will
to give to.
I will say that I think the most dangerous word to use in fundraising is operations. That is a negative. I don't know how in the world it ever got that way, because if you can't deliver health care, if you can't have your operations, but you need to use different language. I think providing care, taking care of with the issue, I mean, whether it's a chronic disease, it's what you do every day. Don't phrase it as operations. You want to be able to make sure that you have the depth and breadth of the staffing and the people that are going to take care hands-on of the individuals that come to you. All those things that make them able to do that job is not important to your donor, but having somebody to be able to care for someone in need is what you're raising money for.
One thing too, what we did several months ago for that same reason is look at how can we talk about the patient outcomes or the patient care and put a number to what that actually costs. Knowing that, for example, if we're saying we're going to, help 10 chronic disease patients reduce their blood sugar levels, like that cost is, it can be everything from the provider time to medication to monitoring. It's all these different things, right? And so split up, the cost so that is covering your technology, that is covering overhead, that is covering, utilities. But what is the actual cost to take care of patients? So I think that by putting it and framing it in terms of people and service and care, knowing, and it's not you're still transparent, but that's what it takes. Yeah. I mean, you have to have the EMR, you have to have.
It's just like saying we provide a day of care, okay? It takes, $2,500 will provide a day of care. It won't really, but.
Won't really.
But it would in reality, it would make a huge difference if somebody would give you a day of care. That is taking care of however many patients you see in a day. This amount of money will do that. That's what people want to relate to. I think you have to stay away from what you're paying for and breaking it down, because it's all about what you're delivering.
Mm-hmm. I was going to, just not to belabor the issue, but one of the things, like one of our clinical directors created a program that she now calls like the chair of care in our dental clinic. And so if someone is to sponsor or support like all of the care that is delivered in that actual physical space over a month or a week, a day, a year, whatever, the idea is around the care. But in order to do that, we need a truckload of equipment. We need a ton of provider time. We need all these things. But if it is packaged as, then we focus then on, this is the many of dozens of patients who are served, or these are the treatments provided, or what have you. So if you can frame it around your patient's needs, it doubles as a more like kind of compelling need. Then we need to pay the licensing fees for our EMR, but also it deepens the understanding of really what our underserved patients need each day.
It's a real different mindset from budgeting to fundraising. When you look at budgets, the idea is, okay, how do we pay for each line item? That's not what this is about. This is about what we're delivering, the lives we're changing, the lives we're saving, the story of that person who came in that had the broken hand and hadn't had it treated in a week. We are relieving suffering. We are doing what Jesus called us to do.